The last of the epithelia that I want you to look at is a specialized epithelium which lines actually some of the internal surface of the kidney, the ureter which leads from the kidney to the bladder, and the epithelium lining the bladder itself. Now this epithelium in older textbooks is called transitional epithelium for reasons I'll explain later, but properly should be called urothelium, and we're going to look at urothelium in the bladder. So to get to this slide on the NYU VM, use Bladder, B-L-A-D-D-E-R, as the search term in the slide search box, and then select slide number 2 from the set of slides which then appears. Here's the overview of the bladder here. The bladder is essentially just a muscular bag. Here's the lumen of the bladder, so this is where the urine would be found. And you can see that the surface here, which is going to be lined by epithelium, is thrown into a very large series of folds that form sort of deep clefts like this. Now actually this appearance is due to the fact that the bladder is empty, and I'm sure you can imagine that if this bladder were filled with urine, all of these folds here would stretch out, and you would have a much larger structure in which you had a flat surface in contact with the urine. And as we'll see, this folding of the bladder when it's empty and extension of the bladder when it's distended has consequences for the appearance of the epithelium as well. Let's zoom in and take a look at the epithelium. So here, even at this magnification, we can see here's the epithelium. Beneath it there's going to be some connective tissue. Let's go a little higher in magnification so that we can make some sensible comments about the epithelium here. So again, this is a straightforward H&E stain, so the basement membrane either doesn't stain or stains very poorly. Looking here, you could tell just by the arrangement of cell nuclei that the bladder epithelium begins somewhere along this line that I'm showing here and extends out to the lumen here. Now, if we look at the cell shape in the lower layers of the bladder, we'll see, looking at the nuclei, that the cells must be quite small, and they're probably round or maybe slightly even columnar if we look at them as they're lined up along here. And then as we progress out through the layers of the bladder, and that should be clear to you that there are multiple layers of cells here. There's at least 1, 2, 3, 4, 5, 6, 7, 8 layers of cells or so. Perhaps over on this side we could count them more easily. There's 1 layer here, a second here, a third here, a 4th layer probably here, a 5th layer here, and a 6th layer here. So somewhere between 6 and 8 layers of cells thick. And so we know now that this epithelium is going to be stratified. The question is, what is the shape of the cells in the outermost layer? And actually this goes back to what I said about whether the bladder was distended or whether it was empty. The shape of the cells in the outermost layer is going to vary depending on whether the epithelium is stretched when the bladder is distended and full of urine, or whether the epithelium is contracted when the bladder is empty and these folds occur. In theory, at least, the shape of the cells in the outermost layer, we'll maybe get a sense of it here, 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 and here, and here, and here. In theory, the shape of the cells in the outermost layer most closely approximates, under normal circumstances, cuboidal. So technically, urothelium is a stratified cuboidal epithelium, but the shape of the cells in the outermost layer, as I said, is going to vary between cuboidal and in fact squamous when the bladder is fully distended. One feature which is present in the bladder, and we'll see if we can see it on any of the cells here, are the presence of so-called dome cells, probably best seen here. And this is where the cells appear to bulge out from the surface of the epithelium. They normally have large, fairly prominent round nuclei. You get a sense here of a dome cell, maybe a sense here of a dome cell. The nucleus isn't in the plane of section. And these cells bulging out from the surface of the bladder, these dome cells, are characteristic of bladder urothelium. Let's just do a quick revision on some connective tissue here. If we look beneath the epithelium of the bladder in this region here, let's go up in magnification just a little bit. What we can see is as follows. We can see thin, pink-stained fibrous material. The pink material is going to be largely collagen fibers, although of course there will be poorly stained and difficult to see elastic fibers here. We can see that this is very cellular. Here's a capillary, actually a blood vessel extending up. There's a red blood cell and a red blood cell, so it's extending up along this way, so we have a capillary. There are other blood vessels here as well. And we see these nuclei embedded in among this connective tissue, and these are the nuclei probably of fibroblasts and a few other cell types. There are some wandering immune cells like this one and this one and this one wandering through the tissue. So this is what loose connective tissue appears like when you see it beneath the epithelium. Incidentally, if I hadn't mentioned it already, the name for loose connective tissue, the layer of loose connective tissue that's found beneath most epithelia, is generically called Lamina Propria. So here we have loose connective tissue beneath the epithelium, and then in toward the core of the bladder here we'll see that the connective tissue becomes a little bit denser, so that here we have classic dense, irregular connective tissue. Now there's also some muscle mixed in here, and we'll come back and look at that at a later point. But this looks, for example, remarkably like the dermis would look, and here are the nuclei of fibroblasts, which are the cells that secrete and maintain this dense, irregular, collagenous connective tissue.